Okay. Which of the following is the most likely underlying cause of this patient's symptoms? Acute pancreatitis, embolization to mesenteric arteries, gastroenteritis, perforated peptic ulcer, or strangulated bowel. This is a 74-year-old woman with a history of AFib presenting to the ER with sudden onset, severe abdominal pain, and nausea for the past 8 hours. On physical exam, her abdomen is soft and tender without guarding or rebound tenderness. The bowel sounds are present but diminished, and she's got an elevated lactate level and leukocytosis. So, so she definitely doesn't have a surgical abdomen. That's what like guarding and rebound tenderness kind of suggests in general. So that kind of eliminates like our perforated peptic ulcer and strangulated bowel because first of all, a perforated peptic ulcer would present with either like air in the abdomen or fluid blood in the abdomen or vomiting blood. Same with the a strangulated bowel would present with a surgical emergency. Um, we don't really have so her abdomen's soft and mildly tender. That doesn't really fit the picture for acute pancreatitis. There's also no like history of chronic alcoholism to go with it, nor do the lab values suggest it. Considering we have the leukocytosis, considering she's like 30, not 34, she's 74 years old, leukocytosis. This is an acute issue, but it sounds like it's an acute illness of like a gastroenteritis. She's got the nausea and the no vomiting, but it really fits, I think, a gastroenteritis picture.
So let me ask you another question here.
Please
Um,
do.
Elevated lactic acid level, or lactate level. What does that mean?
Yeah, I keep saying that, and I know it can mean so many different things, but it would it would suggest there's a good chance that there's a high amount of anaerobic metabolism going on.
Okay, so it also can mean like death, right? Like organ death.
Oh, okay.
Okay, so elevated lactate, it can mean like organ death, right? And also on top of that, right? She's 74, so an older woman. And why do you think you didn't mention the history of AFib? Why do you think they gave you a history of AFib?
AFib and emboli go well together.
Okay, good. So what do you still kind of
No,
fixated?
I changed my answer.
Okay, what do you want to go with here?
We'll go with embolization to mesenteric arteries.
Yeah. So this is going to be their best answer choice here, right? And the reason why is they give you the risk factor of AFib, right? Anytime you have AFib, you got to be thinking of, okay, so clots can just be thrown everywhere from the heart, right?
Right.
It can be thrown into the gut. It can be thrown into the brain, giving you a stroke, right? It can be thrown in the peripheral, right? Where you can have, you know, extremity, like what is it called? Peripheral vascular disease. What's the other one?
Are you thinking
Um,
like DVT?
no, DVT is going to be in your venous system, right? That's going
Yeah.
to be different,
Oh, okay.
right? So remember, when you have an AFib, you're actually throwing a clot in your arterial system. So which is
Okay.
actually really bad because if you clot your arterial, that means you're cutting off blood supply instantly. It's like having a tourniquet but inside, right?
Yeah.
But a DVT, if you remember how a DVT works, that's from the vein side, right? So you throw it in the vein and then it goes through your heart. And then it goes from the right side of your heart and gets stuck in your lungs because the vessels are too small. So it gets stuck in your lungs. So that's usually you're going to get like a pulmonary embolism from a DVT. But when you have a atrial fibrillation, then you can throw clots, anywhere on the arterial side. So this is going to be kind of like you're having a heart attack, right? But for your gut. Does it make sense?
Yeah.
So yeah, so severe abdominal pain, elevated lactate level, meaning like tissue is dying, right? Leukocytosis, I mean, anytime you have inflammation, you're gonna have white blood cell count, right? And then also on top of that, right, you have AFib as a risk factor. Gastroenteritis, right? You're not gonna have severe abdominal pain if that makes sense, right?
Okay. Yeah.
So you're gonna be throwing up, you're gonna be pooping, but you're not gonna, that's like a viral infection, so it's not gonna be as severe. So